Ngā mihi nui kia koutou, and thank you to those who have stayed on despite the technical issues. My name is Amio Ikihele. My background's I'm a nurse, but currently working for Moana Research as the innovations lead and a PhD student at the University of Auckland, looking at cardiovascular disease, niue women, as well as digital health equity. Part of the New Zealand Telehealth Leadership Group, chairing the Digital Health Equity Group. But yeah, pleasure to have the attendees that are here, and again, apologies from our side to yours. Ngā mihi.
Yeah, thank you, Amio. So my name is Yariv Doron. I'm a child psychiatrist from Taranaki, and I'm the deputy chair of the New Zealand TLG, which is the Telehealth Leadership Group. And we wanted to talk today about the 2020. It's been a long and famous year. Lots of lessons and lots of stories to tell for our grandkids when we grow old. And lots of stuff that has been exposed during the COVID and post-COVID. So we wanted to talk about that today. And maybe we start with, because the webinar is about telehealth, maybe we'll start with a bit of a few lessons, a few success stories. So Amio, do you want to start, maybe share with us about the, I know that you're interested in the Pacifica and Maori. Yeah.
Yeah, so I think for most of our communities, Māori, Pacifica, there's been a real collective effort to keep everybody safe. But when we're thinking about telehealth specifically, what I've been really impressed with is the communities, especially those who are considered digitally excluded, more so our elderly. They've really embraced technology, and they've really leveraged off the opportunities during lockdown to learn from their mokopuna, learn from their grandchildren, this new whole digital space. So whilst COVID has exacerbated, or for us, COVID has highlighted the digital divide, it's also provided an opportunity for many of our elders to become connected. And for me, that's the biggest win, is seeing individuals who would never have known how to navigate YouTube or Facebook to go and view online health pages, now being comfortable in those spaces. And this is a journey that I know for a cohort within our own community in South Auckland, I've just seen a lot of growth in this area. And we always have to go back to what is the motivation to get people online, and that also includes telehealth, because when we say, oh, you have to use video conferencing or video tools, we have to really understand what would motivate our communities to use these digital tools. Is it for themselves, or is it to keep their own families well? So for me, that's been the biggest win, is seeing that transition.
Yeah, we had a few wins on many sides. I mean, I think one of the biggest things was the acceleration, wasn't it? It was things that we were working on for 2-3 years all of a sudden happen overnight. I think one of the biggest wins that still stuck around was the e-prescriptions. We did a big shift. All of a sudden, we all could email prescriptions, even if you didn't have any flamboyant e-prescription system. And I think now in the post sort of lockdown era for at least New Zealand, we see a lot of implementation of e-prescription. I must say that from the mental health perspective, the elderlies didn't do too well in terms of telehealth. We found most elderlies would resort to phone consultation mostly. And we also found that some of our clinicians are not really competent. Have you had any dealings with clinicians who...
Yes. So through our organisation, Moana Research, we undertook a rapid review of telehealth services for Pacifica providers after the first lockdown. And we found what you were saying, Yariv, is the modes of communication with patients depends on the ability of the clinicians. So if clinicians aren't comfortable going online or using video conferencing tools or video tools, then they won't be able to offer that as an option for communities or for individuals. So that's the biggest, and I know we were talking about competency earlier on, digital skills. So whilst we have to think about digital skills for our communities, we also need to think about the digital skills that our clinicians have, because they really dictate what tools they would offer our communities. I know when we interviewed some families as part of that review, our families wanted video consultation, but because when they asked their provider, they defaulted to telephone consultation. So again, it does go back to the competency level of the clinicians and whether or not they're comfortable. And again, there's a lot of factors that determine that, whether or not their hardware is able to they have the right hardware, they have a microphone, etc. But I do feel that clinicians dictate what mode of technology or no technology is able to be used.
But the technology is really, I think it's one of the soft bellies here, because what we saw a lot was actually a surfacing of the inequity that telehealth can bring with it. It's not for every family out there that they're privileged enough to have internet, let alone a smart device that can transmit good enough quality of audio and video.
Yeah.
We definitely had launched, I think one of the lessons that we saw from this inequity was surfaced, that we need to do something as a health provider. So I personally work in a DHB, in the Taranaki DHB, and we're starting to do a whole lot of experiments with our community to see how we can help with inequity. For example, we talked about this morning about we identified a marine for one of our major iwis here in Taranaki, and we dedicated a room that was really nicely done with a nice couch and high definition camera that can swivel around and offer telehealth for kids and families who would come in and are not privileged enough to have telehealth capabilities. We're also experimenting a bit with some public Wi-Fi hubs to see if a person does have a device but maybe short on data or internet, then they can have a bit of a Wi-Fi complementary of the hospital, which and again taking care of privacy. And we know that we had a few lovely initiatives from the telecommunications companies that identified static IPs of hospitals and reversed the reimbursement. So that was really good lesson, but I don't know if we have more lessons to learn from that. I mean, the inequity is probably going to be one of our pillars for our 2021 planning.
Yeah, and I think the biggest lesson for us to learn is to listen to our communities, because what you're doing in Taranaki is exactly is you're doing the right thing, where you're going to people as opposed to people having to come to you. So going to places where people already are, which is the marae, where they live, where they work, and where they pray. Because I know a pilot program that we undertook through Moana Research called Ikihele, which is helping to develop digital health literacy skills within a church setting. And we use a church setting because not everybody has an intergenerational household where children are able to teach their elderly the necessary digital skills. So where else are those intergenerational connections are? And that's where they pray. And so we've leveraged off that social capital and used it as an opportunity for young people to again build their own cultural capital, because at the same time they have their offering available for our young people in a space where traditionally their voices may not be heard, but in this space they're able to share and be able to provide elderly with those skills. But I go back to the digital inclusion blueprint from the DIA, which highlights 4 elements, which is skills. They need the necessary skills, anybody, the access, which includes connectivity as well as the device, the motivation and trust, because again, we can give people the tools or the devices to connect online, but what is their motivation to continue doing that? And what I've enjoyed about COVID is it's there is now an all of government response to this digital divide, where government organizations are now working with each other, because the same issues we're seeing in health is also seen with Ministry of Social Development, it's seen with Ministry of Education, we see it with our elderly and our seniors. So for the response, it's been great seeing that all of government coming together.
I want to take you up on the word space. I think for me, as much as I advocate a lot for telehealth, and I thought I knew everything there is to know about telehealth, but really COVID brought it forward with such an intensity that all of a sudden I realized that I can see my clients in a different space. And that actually changes completely the picture. I'm thinking, you're mentioning church, and that I don't want to sound like a too cliche, but it's kind of like talk about healing, and in a place where you kind of you take, I don't know, if you're a religious person, you come to a church, you obviously have some other energies there. But for me as a child psychiatrist, for example, I was almost pushed to start doing assessments at home, and then I realized that now I know so much more about my clients, because you see their little dog and you see the little piano and everybody's giggling on the sofa. We had a really nice success story that I have to maybe I'm happy to share. So we had this kid who was 14 years old, hasn't gone to school for 2 years, lots of anxiety, and the family doesn't know what to do. And he, quote, quote, failed to show up for assessments with all sorts of agencies. And here come COVID, and we got the referral at the same time. And I said, cool, maybe this kid will allow me to see him in his bedroom. And sure enough, he has his iPad, and the mom indicated that, yeah, you can, he said, okay. So I jumped in, and we had a 45 session, as you do, 45-minute session through the iPad. And then I invited myself for another session and another session. And long story short, we diagnosed this kid as someone who has autism, which was really underdiagnosed, painfully underdiagnosed for years on end. And within those sessions, we managed to introduce a psychologist and a behavioral specialist, and we actually managed to prescribe a few medications to support him. And 3 months into the treatment, he's now at school, fully supported, goes to school 5 days a week. That was for us, was a beautiful success story. It's and since then, I'm kind of thinking to myself, maybe I should see everybody on telehealth. And another thing that we found, although we can take care of ourselves, but as clinicians, the word burnout is thrown right, left, and center. But I don't want to sound too precious, but my team and myself, we go through the psychiatry of children and a lot of trauma, and it does get you to days where you wake up in the morning in your bed and you feel sorry for yourself. You're a bit drained. Yeah. So
that's a beautiful story of your client, because it just shows that connection can be made anywhere. But we just have to make sure that our communities can go online. And again, I keep going back to motivation, because we are used to the default mechanism of consultation where we have to be in person, and it is a behavior change. We are essentially changing people's behavior from in-person consultation to now moving to these online spaces. And as soon as people find it difficult to connect online, they're obviously going to default back to those routine behaviors. So it takes time, and you have to make it really easy for people to go online. Otherwise, it just goes back to the default behavior. And yeah, I enjoy your story about seeing where that young boy lives, because it provides a window into their life, and you can see, what is their home environment? Are they living in a home which is contributing to their respiratory infections? Are they living in a home which is, considered overcrowded from a Western perspective? But what are the other cultural values and cultural capital that is that child gaining from those connections? But
and we've learned, to be honest, as a team, to take care of ourselves through telehealth, because these days what we do is, if someone wakes up in the morning and feels that he or she just feel a bit low on energy, we allow our practitioners, our psychologists, our social workers to say, hey, just send us an email, say I work from home today. And they do, and their clients accept that. And I don't know if you tried it, but just to work all day from home when you're taking care of yourself a bit and your dog is on your laps, and it's awesome. It's really good. one thing we talked about this morning, I just want to present here Ruth, who's joined us. We had this TLG meeting today, and we talked about really that when we are doing this journey of telehealth and trying, oh, hello, Janine. And we're trying to focus on our clients, really we identify two groups of clients. So obviously it's the patients are the main concern, but we actually look at our clinicians, our colleagues as clients as well. And some of them need some help. We all know that I think the telehealth a bit polarized our community after COVID. Some practitioners came out and said, yep, I'm sold. And some practitioners came out and said, oh, I'm so exhausted of this Zoom. I can't do it anymore. And I think Ruth, maybe you can tell us a bit about that beautiful project, because one of the things we identified really was that lack of the workflow that has with the Zoom and the booking and, you know, kind of being a doctor myself, I know that we can be sometimes a bit precious and behave a bit like princesses, don't quote me, but, you know, if things don't go smoothly when we come to the clinic, we get angry and we just stomp our feet. So, yeah, Ruth is running a beautiful pilot, yeah.
First of all, I will say that I will definitely quote you, and from now on you will be called Princess. But I mean, you're absolutely right. I mean, some of the worst behaved group can often be our senior clinicians, and that's not necessarily, you know, it's not a deliberate thing. They're scared of change as well. And I mean, Yariv, I think you mentioned today a lovely word, which is something about narcissism or something, but
narcissistic vulnerability, yeah.
Narcissistic vulnerability, which I thought was lovely. You know, I think you're bang on the money. Clinicians do struggle. Partly that is because we haven't educated them very well. I agree, and I think also it's so much easier to pick up the phone, and we did discuss that today. One of the things that we've recognised and what we're doing, and I think a number of DHBs have done, is that the booking process and the technology checks are really hard, and they require some resource. So we have been talking today in NZTLG how we can help support that, and whether there's, you know, something that the ministry can do as part of their, you know, digital enablement projects. In terms of that, also it's probably relevant for people to be aware that there is a newly formed digital enablement oversight group, which is quite broad. It has got 3 NZTLG members on it, and that's really looking at projects which could be proof of concept grown and escalated. So I'll put a little plug in that just on Gets today, for those of you who are used to the Ministry of Health sites, there is a new ROI, so calling for expressions of interest for primary and community care projects, and that actually closes on the 18th of December. So I'll put that little plug in there, and you'll find that on the website, and then I'll be quiet and maybe let Janine comment.
Okay, cool, thank you. Hey Janine, we didn't introduce you. Do you want to introduce yourself and tell us about a lesson you learned in 2020?
Kia ora koutou. I'm Janine Bycroft. I'm a GP based in Auckland, and I'm the Executive Director for Health Navigator Charitable Trust. So that's the Health Navigator New Zealand website. So look, I think obviously it's just been an extraordinary year for all of us. But some of the highlights were the fact that we just galvanized together and having that shared sort of vision and purpose of actually we're all part of the health system. We all just need to do our bit to get through this together. And I thought that was really exciting to see. I mean, over the weekend, the GP College called us all together. We had this emergency meeting on a Sunday evening at 7 o'clock, and the next morning we were to go 80% telehealth. I mean, you just wouldn't imagine that it could happen, but it did. So things can be done really fast when there's that real commitment and purpose. Some of the other highlights for me were the fact that it got through some of the red tape that we'd been struggling with for ages to actually enable telehealth to happen. So I mean, NZ e-prescriptions had been going for what, 3 or 4 years at really slow rates of uptake, and then now it's suddenly up at about 90%, and that gives huge improvements in access for our patients. They don't have to come into the clinic to pick up prescriptions. We can send it directly to their pharmacy. Things like that really do make a difference. Some of the other innovations that we heard about was, I also work at ProCare. One of our practices did a whole lot of amazing things. One was they had Facebook sessions. So they had care in the morning, and they had some of the elders doing sessions in the evening. And I think they had about 3 times a day. They had times at Turkey where they anyone could tap in, and they had thousands of people joining their Facebook live streams because they just so appreciated the opportunity to connect with others. And we say that we often think telehealth isn't for our high need populations, but look, they showed us that they did get it. It was a really important means of communication for them. And I thought it was just so exciting that Lily and the team made that available. And there's lots of other examples from Pacific communities and church groups who did similar things. Dr. Uppy did lots of wonderful updates that were there for the communities. So that was really exciting to see. Also, I think you were just talking about it when I came on online about the huge privilege of seeing into people's homes with telehealth. And we had a number of GPs, even some of our older GPs, who actually said, oh, that was a really new experience, and they really valued that, particularly with younger clients or with our Māori Pacific clients, particularly for mental health. They didn't have to leave home. Mums with kids didn't have to put them all in a car and tramps up to the practice. We could provide that support for them in their homes. So that's been a real big plus, and I really hope that will continue.
Yeah, I must say from mental health perspective, it's been beautiful. I mean, obviously we had the communities that couldn't join into telehealth, so again, our elderly struggled, or clients from drugs and alcohol who are a bit more, they have more issues financially, but otherwise we saw beautiful stuff, and it helped a lot of with family dynamics, which was interesting. We had I can share from my own clinic, I have a lot of families where the parents are separated and can't stand each other to the point where they won't even sit in the same room. And obviously we need them for taking care of the kids. And there's something about telehealth, which is, I don't know, funny. You just say, hey, can we do Zoom? And they say, yes, we can do Zoom. So yeah, now you have both parents, each one of these little cubicle on the screen, and they can stand each other for 15 minutes, but not when they sit in the office. So that was hilarious. And we actually did some family therapies where one family member got stuck somewhere in the world and couldn't fly in. So I had sessions, you know, with dad being in Europe, mom being here, and the kid being at school or at granny. And telehealth really solved a lot of issues for us that geographically would otherwise stop us. And then it kind of brings me to the next maybe question. We're looking into 2021, which we haven't started yet. And I personally, I'm not sure I want to start it. I want to see the term of reference before I start it on, because 2020 really was a bit of a sham. But but I'm looking at 2021, and I'm thinking to myself, okay, there's hope, right? We're seeing vaccinations kind of popping out, and government starting to move, and maybe lockdowns will start moving on. And I'm asking myself, what do I want to see as a professional for 2021? What's on my bucket list? So maybe I'll keep mine to the last, just to be a gentleman, and maybe we'll go one by one. Amio, what's your wish list for Santa?
Like you, I think we're wanting to celebrate the new year, but I think I would want to leverage off the strengths of what we've seen, like what Janine and Ruth has highlighted. Like, we know that our systems can respond, we know our communities can respond collectively, and how can we continue that moving forward and not defaulting back to our old ways of working? I know our communities are open to change, and I know our communities are responsive, but we still have to remember those that may take a little bit longer to journey with us, who are really keen to move on forward. So whilst we know what our vision is, it will take some time for everybody to be on the vision where everyone is digitally enabled and using telehealth. And I think that just goes back to our worldviews, like Pasifika and Māori. We are very relational, and that in-person connection is really, really important. And we are essentially telling people to maybe consider the digital connection as an alternative to the in-person. So it's moving forward, knowing that it's going to be fast for some groups and slower for others, but making sure we all journey together and not to disadvantage those who will take a bit longer to journey along that same line. But that's just my hope, is that we leverage off all of these strengths and the learnings that have been made.
Awesome, thank you. Ruth, what's your biggest project for 2021? Or bucket?
Yeah, look, I think first of all, just having the Band-Aid ripped off the obvious scars underneath of our failure to invest in a digital infrastructure has been remarkable. So my first wish is that we don't lose sight of the fact that we're working within a broken system which almost deliberately exposes our most needy population to harm. And I hope we don't lose focus on that. So that's the first thing I would say. I don't want us to whitewash anything. I think we've had really, really effective conversations about equity, and that's just amazing. I think going forward for me, you know, with my chair of the NZTLG hat on, I see the upcoming year as being a really great opportunity to continue to support and grow this telehealth community. And we've just finished, as you know, our strategic refresh. So anyone out there who's looking for more things to do, then we'll very happily take whatever you have to offer and add it to our working group. So that's my growing the good.
All right. What about yourself, Janine?
Yeah, I'm really keen to see few things. So one is integration, that we really do connect the system up, because there are still lots of silos. Really keen to see that digital support for whānau, so that they do have the opportunity, because we did see a lot of inequities over this time, and we really do need to fix and address that. Like we were saying, that there were just, there's big issues there that we have to address. Personally, we're at Health Navigator, we're working together to try and bring a whole lot of consumer groups together with what we're calling a national consumer hub, so that we start to bring all those best resources into one place and then share that and make it available to everyone. I mean, measles, COVID, just so many examples where we constantly reinvent the wheel and duplicate and make things across the country. And we've been talking today earlier about just a number of things that get duplicated. So we want to do it together, and COVID is just another example where actually we should be doing this together. And so we're really wanting to get that off the ground and functioning well next year.
So Janine, maybe I'll take you on that, and I'll say maybe one of the things we would like to see in 2021 is us showing that we've learned a lesson in 2020, because like you said, we had measles, black plague, you name it. Once every few decades, we have something that comes and wipes us out. Are we really ready for the next COVID 52 or SARS 7 or whatever? I think, if we don't show in 2021 that we have matured and we have learned our lesson and we have a bit of a scar that still hurts. And I mean, to be honest, we need to be so grateful to be living in this beautiful country, because while we are having this fun, we're seeing Ruth in a car and we all spend the day in Wellington and whatever, most of our friends around the world are either sitting in lockdown or walking around with masks. So we really need to be grateful for that, but not complacent, because that we need to appreciate that it is a tipping point at any given moment, and New Zealand can be swept by COVID. It doesn't take much. So are we ready for that? Hopefully not, but next wave. What do you guys think?
Look, it's a really good point. And on the HINS webinar that they had yesterday, they talked about the importance of that emergency planning, and that we actually, as a health sector, need to be much more proactive around pandemic planning and so forth. And so the Auckland region are looking at what are the 4 most common emergencies we might face, and actually starting to be more strategic around that planning. And we need to do that across all regions and nationally, because fire brigades, they do it weekly practices. Lots of other sectors have much more regular practices. We only do CPR every 3 years. So I mean, Ruth will do a lot more, because the nature of your work is that you're doing it every day. But across the rest of the sector, what are we doing to really make sure all those systems and that civil defence, that it's all just connected up for those scenarios?
What about yourself, Amio? how are you going to show us that you're ready for next year? Finishing
Yeah.
it first. Yeah.
Just to talk about what Janine says, we always have to be prepared, and if there's that constant small behavior change that's available for us, then that provides us the opportunity to respond if we need to in a bigger way. So small changes over a longer period of time will be more responsive than having to go from crawling to running overnight. But we know that we can do it, but it's not probably necessarily the best way to do it.
Yeah.
So all of those small changes building up to the bigger one will definitely be more effective.
And we need to remind ourselves that telehealth is, as much as we love it, it is a piece in the puzzle, really. That's what we're saying here. There's a lot of systems that needs to kind of shape up as well. Ruth, any proof for 2021 that you've learned a lesson?
Well, look, I was never a very good Girl Scout, so you know, the fact that I'm still in my car probably shows that I'm not very prepared. But you know, I think that just looking after each other actually would probably be my biggest thing. You know, appreciating each other, appreciating you know, that physical touch, as well as, you know, those around you, your family, your older folk, you know, you know, all of those things for me. And I think for a lot of people have been quite clarified, you know, what's really important to you. So I think going forward, taking those things with us and taking care of each other is going to be high on my list of things.
I have a little dream for 2021. I must share. We're obviously now starting to see some committees and work groups starting to work on the Spencer report, and we will probably end up having amalgamated DHBs into 5 or 8 groups. My dream is that we'll have +1, and that +1 is going to be a virtual one. That's my dream. If we can make that, then I'm a happy man. I've seen it in Australia when I was visiting there, or when I'm working with them. They have, just mentioning today, they have, for example, a complete virtual ED for mental health in New South Wales, and they have an entire team just ready to pop in, cover every rural aspect, every corner, fully staffed, fully equipped. And I'm looking at our beautiful country, and I'm saying to myself, can we not do that? I'm a psychiatrist, for example. I'm sorry to use myself as an example. We are a dying breed. There's not too many of us. There's a shortage all across the country. Why do I have to stick to Taranaki? I mean, if there's 2 days missing in Hawke's Bay, I would like to be able to jump on my Zoom and help the Hawke's Bay Taranaki. And if I know that South Auckland had big shortage for quite a while, all 3 child psychiatrists have disappeared. So maybe it's enough to say, I live in Taranaki, therefore I will work for in Taranaki. I would like to say I live in New Zealand, therefore I work in New Zealand. And I think that's what telehealth could and should bring with it. So that's my my little prayer for Santa. Maybe last word, because I'm noticing that we are heading towards 8 o'clock. So Janine, I'll start with you. Last word goodbye to our crowd. That, again, we apologize for the really late and delayed start, but yeah.
Yeah, one of the other things I'd love to see for 2021 is that we've got a standards around apps and e-therapy and that digital space, such that we have confidence that we can prescribe apps or online solutions. So yeah, being part of a little bit of work that's doing some early stages of that, and would love to get to that stage. And yeah, look, gosh, the idea of virtual telehealth DHB or teams across the country just makes such sense. That would be awesome.
Yeah, I mean. Amio, last word.
Yeah, I think I like what Ruth said, just about looking after each other, both from your colleagues as well as our clients and patients, consumers, whatever you call them, you know, the people we serve, you know, just making sure that we're checking in with them all the time, because I know for a lot of our Pasifika communities, that was probably the biggest response mechanism, was just checking in as opposed to the whole transaction of health intervention. It was just seeing how they were, seeing how their families were, seeing how the communities were. And for me, yeah, that's really important. So I think, yeah, just focusing on that moving forward, then hopefully everything else can be built on that.
Thank you for that. Ruth.
Yeah, look, I think just building on everything you guys have said is perfect. You know, we're in a service industry where the majority of us are at least partially funded by the taxpayer. And that concept that you give, Yariv, of, you know, I live in New Zealand, I work in New Zealand, I should supply care to New Zealanders. I think that's music to my ears, and what a great way to go into 2021.
Yes. Thank you for that. So, hey, just wanted to say again, thank you and to our participants, and thank you for our presenters. And I think, you know, our delayed start has shown another lesson from 2020 that we're here to solve problems, even when we're surprised. Hopefully we entertained you enough and provided you enough stuff to think of. Merry Christmas, everybody, and have a good evening.